Hi there, I hope you're well. Thank you for clicking to this video. Today we'll be talking about malaria, and I know you probably have heard about malaria, and I will be now doing it in several parts because it's quite a large area of science. And for this part one, we are going to just be getting an overview of what is malaria, what are the causes of malaria, what is the pathogenesis and the clinical symptoms, what's the life cycle, among many other things. So stay tuned, and I want to welcome you again to my lab family where we have a moment of science. And my name is Lucy. If you are joining me for the first time, thank you for coming and thank you for clicking onto this video. And I cannot wait to have you as part of my lab family. So kindly like this video, kindly subscribe to my channel so that you can be getting all the updates as pertains to this channel. And I know and I can assure you that you're going to have a good time as we learn on various medical science, molecular biology, biotechnology topics that I've actually posted quite a number of them, and others will always be coming. So for all of us, thank you for always supporting my channel. Kindly keep liking. Even now, I'll just give you 1 minute. Kindly click the like button down in the description of this video. And if you haven't subscribed, subscribe, comment, share, and let us, grow this my lab family. What are we going to be learning today? We will look at what is malaria, what is a clinical picture of malaria, and what is the epidemiology of malaria in this part. And then on the next part, we'll be talking about the life cycle of malaria and its pathogenesis, laboratory diagnosis, prevention, and treatment. So, what is malaria? First of all, it's a life-threatening disease that occurs in the tropics and subtropics, and it is a mosquito-borne parasitic tropical disease because it is usually spread by an infected female Anopheles mosquito. And you can see this is this female Anopheles mosquito, and this mosquito will become infected with the Plasmodium parasite after it has had a blood meal on an infected human. So we usually will have 5 species of the malaria parasite that will infect humans because we have other malaria parasites that usually will infect other animals. So for the 5 species of malaria infection that usually will infect humans, we have what we call Plasmodium falciparum, Plasmodium vivax, Plasmodium ovale, Plasmodium malariae, Plasmodium knowlesi. And among these, usually we'll have Plasmodium falciparum and Plasmodium vivax as the ones that pose the greatest threat. So you will realize in the subsequent discussions of malaria, I'm most likely to be talking about Plasmodium falciparum and Plasmodium vivax. Now, a small or a snippet into the clinical picture of the very first clinical symptoms that usually will occur, what we call malaria paroxysm. Usually we begin with chills, and chills are characterized by feeling intense cold, vigorous shivering that will last for about 15 to 60 minutes. And this phase is going to be followed by fever, and fever stage is characterized by intense heat, dry burning skin, throbbing, headache, and this one will last about 2 to 6 hours. And then we have the last stage that we call sweating, and sweating is going to be characterized by profuse sweating and then declining temperatures, of course, because once you lose water from the body, you're going to have reduction in temperature. Then we are going to have exhaustion and weakness that most of the time may make you feel like you want to sleep. and then this is going to last about 2 to 4 hours. So these symptoms usually will appear about uh, 10 to 15 days after you have after you have had an infective mosquito bite, and sometimes they can be mild and difficult to recognize as malaria, and maybe that is why sometimes they will be left untreated in several populations and then progress to severe illness and even cause death within as less as 24 hours. Malaria can be put into two, either acute disease or chronic disease. For acute disease is where we have non-severe acute febrile disease that infects, and then this can likely now become severe. So when it has started and probably the symptoms are a little bit mild and then maybe left untreated become severe, malaria can lead to cerebral malaria, which is a complication, and even death, as we have said, even within 24 hours. Then we have chronic disease, and in chronic disease, we have what we call you get infected but you do not experience symptoms at that particular point. So you have an asymptomatic infection, and this asymptomatic infection will go and cause anemia, and this anemia will lead to developmental disorders in children, a requirement of transfusions because your body is not being able to make enough red blood cells, hemoglobin, and so on. And eventually, it could also lead to death. And then we have chronic disease that usually will occur during an infection in pregnant women. And this results into what we call placental malaria once the infected cells, red blood cells, cross from the mother to the placenta. And once they do that, they will result into pregnancy outcomes that are not favorable, such as low birth weight in newborns, infant mortality, and even in the maternal or the mother, it can cause anemia and eventually death. Complications of severe malaria, and in this case, severe malaria, we're defining it as a symptomatic malaria in a patient who is infected with P. falciparum and they're exhibiting one or more of the following complications. One of them is cerebral malaria, which is characterized by generalized convulsions over 2 episodes within 24 hours, and severe normocytic anemia, where the hematocrit or the amount of red blood cells is less than 15% or the hemoglobin is lower than 5 grams per dl. Usually, our hemoglobin will be about, for women, 12 to 16. For men, it will be about 14 to 18. And in children, it's about, 9.5 to 14. In pregnant women, by the time they're in the third trimester, it can also be about 10. So you can see if it gets to below 5, then that is quite severe infection. And that means that our red blood cells have severely been destroyed. Then we have hypoglycemia and pulmonary edema in pregnancy that will lead to abortion, stillbirth, and this has been observed a lot in Africa. And this is characterized by metabolic acidosis with respiratory distress, where the arterial pH is lower than 7.35. That means we are having acidosis, or we are having carbonate, bicarbonate being less than 15 millimolar per liter, and bicarbonate usually will help us to return the pH to above 7.5. So if it is less, then we are having metabolic acidosis. Then we have fluid and electrolyte disturbances in this situation. Then we have what we call acute renal failure, commonly called the black water fever. And in this, we have acute pulmonary edema and adult respiratory distress syndrome. There is abnormal bleeding, there is jaundice, there is hemoglobinuria, that is hemoglobin in urine, there is circulatory collapse, shock, and septicemia, and of course, hyperparasitemia, over 10% in non-immune. Non-immune means individuals who are contracting malaria for the first time and they have no immunological memory of malaria parasite, and when we have over 20% in semi-immune individuals who have previously been exposed and therefore have a number of antibodies against malaria parasites. Then we also have tropical splenomegaly, where we have the spleen being enlarged. In pictures, this is hypoglycemia and pulmonary edema in pregnancy, and you can see that the lungs are full of water, and this is dangerous, especially in pregnancy, because it will lead to preterm birth. And then in cerebral malaria, we talked about convulsions. We have also talked about malarial hemoglobinuria, and here we have what we call the black water fever. It is not very common, but once it occurs, it's also accompanied by anemia and renal failure, jaundice, and you can see like here, this is normal urine, and the urine of patient who has this hemoglobinuria is going to be dark because we have had release of hemoglobin into the urine. And then we have now the anemia. For example, here we have a child who has severe anemia, and it is also characterized with acidosis and respiratory distress. And that is why they are on oxygen. We can also have severe anemia in children or individuals with no other malaria complications, like in this situation of this child. We talked about tropical splenomegaly, and this is where we have our spleen being extremely enlarged, and you can see in this chart how it presents. And these are all caused by malarial infection complications. Now, the malaria epidemiology in the world, this is statistics of 2020, that is World Malaria Report 2021. We had estimation of about 241 million cases worldwide in 2020, and that's a huge population that are at risk to getting malaria. And among these, an estimated of 627,000 deaths occurred in 2020. Unfortunately, in the African region where I come from, where is now our home, we have over 95% of malaria cases. These 241 million, 95% of them are in Africa, and 96% of these deaths are also in Africa. And that is why most of the time we have at least every 2 minutes a child who is under 5 is dying out of malaria. And the highest risk groups, of course, are children under 5 and pregnant mothers. So this is now the incidence across the world for the malaria new cases, and this one is represented or shaded per 1,000 population at risk. And where we have these lines, grayish lines, is where we don't have sufficient data on malaria incidence. And this is North America. We have parts of Europe and Asia and Australia. Now, for Central and South America, we can see that the incidences of malaria infection are not as much because a great percentage of it is about just 0 to 10, and with some 10 to 30 around this region. And then we also have across Asia and Middle East also being 0 to 10 per 1,000 population at risk. And then we have Africa, South Africa, and a great part of North Africa. We also have about 0 to 10 new cases per 1,000 population. And now West Africa, Central Africa, and East Africa, we have over at least 50 to now the 1,000 population or new cases per 1,000 population at risk. And for Kenya, where I am, we are around 50 to 100 new malaria cases per the population of 1,000 who are at risk of getting the infection. So that is what we have planned today. Just an overview. We have looked at what is malaria, what is the clinical picture, what is the epidemiology, and what shall we learn next? We will be looking at the life cycle of malaria, diagnosis, and treatment. Thank you for being part of this tutorial. I hope I can see you next time. And remember, if you have not subscribed, can you do that now? And like this video and other videos, go to my YouTube channel, just scroll and see what other videos will be of interest to you and interest for your colleagues so that they can also be part of my lab family.